My name is Marcy Nielsen. I'm the CEO at the Patient-Centered Primary Care Collaborative, and I'd like to welcome you all to our open forum call for the Employer and Purchaser Engagement Center. We are thrilled that you were able to join us, and we are looking forward to your participation today. I'm going to tell you a little bit about what today's call is going to cover, and then I'm going to introduce to you one of the co-chairs of our center who is going to walk you through some of the opportunities to provide feedback and get some of your feedback as we build out our Employer and Purchaser Engagement Center. So I think many of you are already familiar with the PCPCC. We'd like to do a brief introduction to this particular center, who's leading the center. As I've mentioned, get your feedback about some of the work that we're planning this year in terms of our strategies and objectives, and even talk about future years. As many of you know, each center wrapped up their leadership retreat in January. So we had 5 center retreats, and each of those centers spent time defining their goals and objectives and the tactics to achieve them. Now what we'd like to do is bring in the public and have you weigh in on the work that we're planning. We're very eager to hear what you think, and so I'm hoping that we get lots of questions and inquiries. We'll tell you how to do that and how to weigh in as we go through this webinar. I did want to remind you that these particular calls, these open forum calls, are quarterly, and we're anticipating that the next Employer Purchaser Center open forum call will be in June. That opportunity will give you a chance to look at our final plan for our work this year and an outline of the deliverables that you can expect from all of the centers. Deliverables including publications and events, white papers, fact sheets, etc. Because this is an open forum call, there may be members of the press joining us, so I just want folks to be aware of that. So I'm going to move on to slide number 2. In terms of our agenda today, here's what we plan to cover. We're going to give you an overview of all the centers and their role within the PCPCC, an overview of our communications. And then, as I mentioned, I'm going to turn this over to Becky Brochet from Pfizer, who is one of the co-chairs of this center, and she'll talk about the goals and objectives that this center has defined and lead a discussion. We'll be looking for your feedback, and we'll be facilitating this session and providing feedback to all of you, to our executive committee, to our board, etc. So a little bit about audience participation, and there'll be additional guidance as we go on today. But the feedback from today's discussion, we're going, as I've mentioned, to be feeding back to our board, to our EC. We'll be actually asking you to vote on some of the information that we'll be sharing with you. We do take our poll questions very seriously. We're going to ask you to rank the importance of some of the work that we plan this year, and this is going to be used by the center leadership as well as the staff of the PCPCC. For those of you who are not familiar with the technology that we're using today, I just want to highlight a couple of things. Again, we will help you during the course of this call. But in order to be able to talk during the question and answer portion of the call, you're going to need to enter in the audio pin, which is located on your webinar dashboard. So again, we'll refer to this when we get to the Q&A section. The polling questions are going to be popping up on the screen, and we'll be allowing you a few moments to cast your vote. And then we'll open up the lines after each poll closes to discuss the results. And at the very end of the presentation, we'll have an opportunity for some dialogue. There's 2 ways that you can get in line or in the queue to ask questions. One is actually to use the raise your hand function to have us call on you, and then we'll unmute your line. Or you can actually just type in your question into the chat function, and the question will be fielded to the appropriate person on our call. So without further ado, I'm going to dive into slide number 3 and tell you a little bit about our stakeholder centers. As I've mentioned, we have 5 stakeholder centers. They've been reorganized and restructured since last fall. You see the 5 listed: advocacy and public policy, care delivery and integration. This center, which is the Employer and Purchaser Engagement Center. We've got outcomes and evaluation, and then patients, families, and consumers. And the Stakeholder Centers, we want to use very thoughtfully to be responsible as our incubators and the drivers of the PCPCC's core activities. And I think what you'll find is the heart of our work is going to happen within these centers and then be shared across all of the centers. We do have some specific task forces and special interest groups that are important to the PCPCC, but the bulk of our work is going to happen through these centers. As you might imagine, they're set up to achieve goals that relate to specific audiences and interest areas. And what you may not be aware of is that each center is being led by a cabinet. So we call them the leadership cabinet, somewhere in the range of 10 to 20 individuals. Participation in that cabinet is limited to those individuals who are either members of our executive committee, and those are the dues-paying members of the PCPCC, as well as other invited thought leaders that we've identified to fill in gaps in content expertise. So those are the leadership cabinets for each center. Having said that, obviously each of the centers is open to the public beyond this leadership cabinet, and that's really what you all are as members of the PCPCC or as participants in today's open forum call. Cabinets, the leadership cabinets do meet on a monthly basis, and they report, discuss on progress, etc., refer to other centers' work, and any questions that you might have about the centers, I'm going to direct you to Tara Hacker, many of you who already know Tara. She is the Director of Programs. She's here on the phone with us today, very easily accessible by email. And I just note for you that her contact information is included on the last slide and, of course, on our website. So moving on to slide number 4, just to tell you a little bit about center communications. So how is it that we communicate with the centers? First, each center has a dedicated web page that you can access from our homepage. Many of you have spent some time on our homepage at pcpcc.net. It's shown in the slides. I should tell you as an aside, we are very excited that we'll be launching a brand new website in the next few months. It's going to have much more robust content, new technology that allows us to have resource libraries dedicated to each center's topics, easy access to meeting materials, news updates, etc. In addition to then the website, many of you have also been receiving a monthly newsletter that comes out from each center. Starting in February, in an attempt to make sure that all of the centers are cross-fertilizing one another and everybody understands what's happening across the PCPCC, we're going to be consolidating information into a single newsletter. That way we are both ensuring that you understand what's happening in all of the centers, but we're also not flooding your inboxes, which we know you get a lot of materials from the PCPCC, and so we want to be mindful of making sure that the emails you get are of high value. The monthly updates are going to include information about webinars. As you know, that's something that we do a fair amount of. Each of the webinars is going to be developed and sponsored by a center. And on average, we plan to offer about 2 webinars a month. You can subscribe to the center monthly update through the center web pages. But we also highly encourage you to get your news through social media, as we're both pretty active on Facebook and Twitter, and so hope you take advantage of those resources. Moving on to slide number 5. This slide tells you a little bit more about our center structure and how the centers fit into our larger organization. You'll see here where the centers live in the PCPCC ecosystem. You've got the board of directors there, the executive committee, again, those dues-paying members, and as I mentioned earlier, the task forces and the special interest groups. Now, without further ado, I would like to introduce you to one of our two co-chairs, although it is possible that Anshu Chaudhry, who is with Blue Cross Blue Shield Association and serves as their Director of Strategic Initiatives, may be able to join us a little bit later in the call. But Becky Brochet is the National Director of Employers for Pfizer, and she is here with us. We so appreciate her leadership and the time that she has devoted to our organization. And so without further ado, I am going to turn this over to Becky and thank all of you again for being with us this afternoon.
Thank you, Marcy. I appreciate that. And in the power of teamwork here, I'm going to be leading our exposure of our objectives and tactics and want to get your feedback on them. But our team here is working together, so if Tara and Lauren, you will help me as far as polling and changing the slides, I'd greatly appreciate it. Before we dive into all of the nuts and bolts about what the center has been getting into, we want to make sure that we're putting it in front of you with your point of view in mind. So before we dive in, I'd love to ask you a couple of quick poll questions. In case you can't see these completely on the screen, the first question is to ask your point of view and where you're coming from. So what is your current role in your organization? The choices that are on the screen are primary care clinician, work for a small business, government employee or official, work for a nonprofit professional or trade association, or work in private industry or health plan. We'll give everybody a minute here to make your selection, and we'll post those results. Okay, well, we have a nice broad spread of folks on the phone today, which is fantastic. Looks like the majority are coming from nonprofit, professional, or trade associations. But there's great representation across what we firmly believe is a broad set of stakeholders when it comes to the value of patient-centered medical home. And as Marcy talked about with the Center for Employer and Purchaser Engagement, this really comes into play. One more quick question that we'd love to ask you is, what is your interest in participating in this call today? So the selections that are there, in case it's gotten cut off for you, are provide input on messaging patient-centered medical home to employers, plans, unions, or is it about learning best practices of medical homes and work wellness programs? Does it have to do with dialoguing with experts in the field? Learning about medical home within context of benefit redesign or other? And we'll give everybody a moment to choose those, and we'll show the summary results. This is when we need the Jeopardy song, I think.
Ding, 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 ding.
There you go. Fantastic. Again, sort of a broad brush here as far as interest goes. This helps us a lot as both we're going through the call today, but also it helps us when we understand from those who are interested in our center with where you're coming from and what you're looking to achieve as well. Looks like the majority of folks here are looking to learn more about the medical home concept within the context of benefit redesign, and that's great because it's a lot about what we're going to talk about today. So if we want to switch just over to slide number 8, we'll talk a little bit more specifically about the Employer Purchaser Engagement Center. So sorry, multitasking here. Our particular center has the goal of engaging large private and public employers with small businesses, health plans, and unions. So across the board as far as those who are supporting employer benefit coverage. In addition to that is the goal for incorporating medical home features into benefit redesign. And of course, with so many new payment models coming up every day, having it seated in there as a bedrock. Again, also talking about sharing best practices, this is the place where we want to have a respite for those and be a resource for others in terms of best practices on successful employer and purchaser models. And obviously being able to highlight those even to the extent of incorporating workplace wellness initiatives and prevention programs into the patient-centered medical home model itself. If you go to the next slide, those goals have really gelled into key objectives that were brought to bear by our leadership cabinet. And we really do have such a great broad brush of folks that are involved with this. And it is truly an honor to be working with the folks who I've just had the great experience to work with even just recently at our retreat. But as you can see here, a full list of folks coming from a lot of different points of view in terms of keeping the focus rich on what we want to achieve, but bringing a lot of experience to the table. So the next slide will show what we've decided in terms of key objectives to achieve our goals. Our first strategic objective that we really came to clarity on is developing resources for plans, consultants, and brokers about the shared value of primary care, medical homes, and other key drivers that are really going through transformation. The second objective is to develop resources for large and small employers about that shared value for a patient-centered medical home. And lastly is to develop resources for employers, plans, labor unions, and their employees and members in utilizing medical homes. How we make that happen is the secret sauce, and so we've really taken that down to some key tactics as well. So in our leadership retreat that you'll see on the next slide, we came up with some specific ones for the first objective. When we're talking about having the plans, consultants, and brokers seeing and being able to use the shared value of medical homes, we quickly realized that it needs to have all of the stakeholders' contributions to that transformation. So first we wanted to make sure that we identify the gaps between different key stakeholders, and those are all now represented in the center, which is fantastic. We have a plan to host an employer summit to engage the mix of dialogue of all of the stakeholders around the employer in terms of really clarifying the value of patient-centered medical home as part of the core benefit redesign. We also talked about considering adopting the Choosing Wisely campaign or other campaigns and organizations to really amplify this change. And while we have lots of great resources that are housed in the website for the center, we want to make sure that our purchaser guide that's core to that gets updated to really communicate this improved value. And lastly, talking about creating tools on solutions for the healthcare system and how we can make it actually be more efficient and have that circle of care that is patient-centered medical home be core to that, and messaging that across the other centers and their audiences too in PCPCC. So those were some of the key tactics we talked about developing, and a lot of dialogue is going on with those. We'd really like to get some feedback, though, from y'all in terms of what you think about those particular tactics and which ones you think are top priority. If we could just take a quick poll here of the tactics that I've laid out, then tell us what you think are the ones that are the one that should bubble to the top for you. I'll take a second here and let everybody make their selection. And while we're putting this together, I'll give you a heads up. Once these results come, if you would like to make some comments or ask some questions, feel free to either type them into the question box or raise your hand and we'll unmute your line. We'd like to hear from you too. You know, real live voices are always great in addition to the technology that we're using right now. So Lauren, how are we doing on that result? Here we go. This is great. So across the board, it seems like the top priority is creating the tools on solutions for the broken health system. Obviously, that's a key area it's broad and it's deep in terms of what those tools should be, and we'll continue to keep working on those. But has anybody got any additional comments as far as why they felt this was the top priority? Happy to open up the lines if anybody has comments.
If you just raise your virtual hand there on your control panel, we can unmute you right away.
Well, let me ask one particular question here that might spark some additional dialogue is, what have we missed here? Are there particular things that you think you're not seeing here that would aid in our objective here of really bringing together that shared value across plans, consultants, and brokers?
You can also ask questions typed as well if you'd be more comfortable to make a statement that way, and we'll make sure that your opinion is heard. All right, Mariana Webb.
I need to unmute my side. I have actually chosen the Choosing Wisely campaign. I'm a director of a small physician hospital organization, and we've been really promoting that heavily because I think the thing that we really need to make sure that employers and consultants and brokers understand is that there needs to be engagement by the patient and understanding, you know, what things are really necessary in terms of testing and protocols. That Choosing Wisely covers that. So I guess one of the things I would recommend is that there is a focus on teaching that self-management piece, because physicians can only do so much. They only have those patients for a few moments of time.
That's a great suggestion and great feedback too. I really appreciate that. And obviously, it also circles into the necessary resources that would be needed under a group benefit plan that supports a patient-centered medical home model. Because through the communications in a group plan like that, having that resource in terms of Choosing Wisely or other campaigns could be very helpful. Thank you for that. We do appreciate your feedback. Is there anyone else that has any questions or comments about these particular tactics? Lauren, I'm not sure if I'm able to see the hand raised, so keep me honest if I'm going too fast.
I will.
Okay.
No, I think we're ready to move on. I think that we're good.
Okay, so we'll go to objective number 2 and talk a little bit about the specific tactics that the center has developed, looking at developing these resources on a shared value. So what we're talking about doing so far is defining that value proposition to large and small employers. This is something that the center has been working on for a while, and I think we've come to the new reality that it's got to be a value proposition that's not just valuable to the employers, but to the employers and their sort of the health management partners that work with them, because it takes that village to really change and create that benefit redesign that puts it into play and makes it real. So with that, we also need to re-engage employers by identifying their medical home neighborhood activities and their needs, because there are, of course, a lot of medical home activities going on, but making that connection to group covered benefits is key. The third part about it is creating that alternative risk sharing arrangement between employers and payers. And there's some good work that's being done there across the country in terms of different kinds of arrangements. And so that dialogue needs to seep into the concept of the patient-centered medical home as well. And then lastly, developing a clear, concise message that really defines the medical home. And obviously the understanding there is that there won't be just one message, but it'll be clear messages heard by different people, so there would need to be the communication of different messages there. So these are the kinds of things that we're talking about in terms of really inking it in as far as that shared value goes. If you wouldn't mind letting us take a pulse from you again on your thoughts on these and which ones that you think are most important. So if you could select one from the list. And we'll give you a second here to summarize those. Okay, Marcy, it says you can't vote. Lauren, how are we doing with summarizing the poll?
We could wait for, I think we are good about now. If you want to show it.
There we go. Excellent.
It's a close call, so I think we're waiting a little bit to see who won out there.
Well, this is great feedback because y'all have definitely seen the same thing that the center has in terms of really defining that value proposition. It's far easier said than done, and this is the key work that's really led us to think about different ways that we could do that, and it's refashioning that message so that it does include the health management partners as well. Hello? Hello? Missed someone there. Sorry. If you do have a question, what I'd love to do is open that up now and tell me what your thoughts are in terms of this being a priority. Anyone who felt that the value proposition was a top priority want to make a comment on that?
Again, if you raise your virtual hand, we can get you joining the conversation.
And this is really a key new area of work for us in terms of really refashioning that statement in terms of the value prop. So anyone who has ideas or comments would be greatly appreciated here as we move forward to try to really make that crystal clear.
So we do have one comment that Kate Cross typed in, and she made the point that synchronizing efforts is important. Currently, there are a number of diverse efforts underway. Awareness of those efforts is helpful, and the PCPCC has contributed to this.
That's great. Thank you very much for the comment. And I think there is absolutely true, and that's so important that we make sure that as the second choice of these tactics shows in terms of identifying those activities that are going on, there's a lot of great work going on, and we want to make sure that it's known by the folks who would be supporting patient-centered medical home through the employer-purchaser lens. Thank you very much for that comment. Okay, so we're going to move on to our third objective, which is developing resources for employers, plans, unions, and their employees and members, and utilizing the medical homes and all the great work that's out there. So some of the tactics that we've come up with so far in terms of objective number 3 is defining the role of employers and assisting employees in accessing the medical home, developing a map for locating the medical home, share models of benefit redesign that promote access to those medical homes, and I think there could be some very creative ones there, share models and best practices to build the networks, update the 2012 benefits of PCMH publication so that we feature even more case studies as they become available and show success. We're also still very ardent about putting together an employer summit to clarify these messages and these tactics, and we want to make sure that these case studies are not only captured there, but presented there for future communications as well. That can be teases out to the last tactic there in terms of white papers and other communication pieces that we'll have. So this is where the bucket of resources that y'all have shown has been a top priority. It was borne out a little bit more. So if we could maybe get a little feedback from you on just looking at priorities of the priorities, and let us know what you think of as far as these go. Okay, well, that's great feedback too, and sharing the models of benefit redesign keeps bubbling to the top. Obviously, you can hear that this is a priority for us, and we appreciate the fact that we feel like you're telling us we're a little bit on point here, and that's great. This is an area too where developing resources could be a huge lift. And so priorities are important, but we know that we shouldn't oversimplify. So I'd like to open it up here for other comments or questions in terms of anyone who might have other thoughts of resources that would be important to have, or make sure we haven't missed something.
George, patron?
Yes, thanks much. I'd like to put on this objective 3, the importance of all of our sections in PCC emphasizing patient-centeredness. And I guess in talking to employers and so on, with the employees accessing healthcare is important. I'll just say that we need to keep in mind that as people have asked me, how can I get better healthcare? How can I figure out what's going on with me? The system seems to be disjointed in whatever state they may be calling me. I have trouble referring them to a patient-centered medical home type of a clinic. So while developing maps for locating medical homes got 0%, and that's fine. I voted for the benefit redesign to promote access, really promoting access to a patient-centered type operation, and ideally employers who believe in it, that it's the best way to have healthy employees at work doing their job. That we should always keep in mind patient-centeredness, which means employee-centeredness, and locating where these are at and how to get patients to be able to change their health plan versus health insurance. Another vocabulary problem we have is health insurance does not guarantee you access to health care at all in this country. That'd be another thing to think about, making sure we address in this area.
That's a great comment, and we'll make sure that we're clear on our lexicon as well, but I think your point is very distinctive there between the two, because at the end of the day, we want folks to have that access to a PCMH model practice, and we know that's going to be the best care. It's also the most efficient care, and that's part of that value proposition and redesign that we're working towards. Thanks so much for that. I really do appreciate that. Any other comments or questions from folks of other types of resources that we want to make sure that we don't overlook?
So Becky, this could be fielded by either you or Marcy. We have a question from Virginia Barzan, and she asks, how does benefit redesign relate to the development of health insurance exchanges?
And
Marcy,
Becky,
you want to take?
I'm happy to. So the benefit redesign piece is as folks are probably aware, kind of a secondary goal of the state insurance exchanges. First and foremost, the states and the federal government, the feds operating in most of the states in either partnership or managing the exchanges, their first priority is getting people insurance and figuring out when someone comes in the door to an insurance exchange, what is the right benefit for them to select. So they're basically going to be shopping just like they would be on Orbitz or Travelocity. And then do they get a subsidy once they are all of their information is entered. So their primary focus is on access. Having said that, a number of states have long been thinking about benefit redesign and they're starting to think about how they might use the state insurance exchange structure to promote quality of care and benefit. We like to call it value-based benefit design. How you might couple those two, we think, is perfectly appropriate and a terrific way to use the exchanges. But I think most folks at the state level will tell you they've got a lot of things they need to do first, and that's to figure out how they get people covered. Of course, anyone who walks in the door to a state insurance exchange also has to be evaluated for whether or not they qualify for Medicaid. So states have a lot on their plates, and we are keeping our fingers crossed that we have an opportunity to partner with a number of states as they think about the benefit redesign piece, patient-centered medical homes, but we recognize it's sort of first things first, so the focus will first be on access. Becky, I don't know if you have anything to add to that.
No, that was great. Thanks. Did that answer your question as far as their relativity between PCMH and the exchanges?
Becky,
I'm not sure
if Virginia has. Oh, she said yes for now.
Okay, great.
I love that answer, by the way, because that's how I feel. Yes, for now, we'll let states get the access piece down, but we would be really missing an opportunity if we didn't think about ways in which we could help improve the structure of health insurance, as well as how benefits are delivered through healthcare redesign. So couldn't agree more.
Yes, thanks. Now, one of the things we want to do too, and just one last quick poll from you before we open it up for discussion, is if you were to say to yourself at the end of the day, of all of these things that I've polled on and given my votes for, that I want to see that this center walks away with and gets done, which one would it be? So we'd like to poll you based on the top priority responses of the 3 objectives and their tactics, and even from there get the priority list straight, make sure that we're doing that. So of all of the number 1 objectives, then can you give us some feedback on which ones that would be the most ones that at the end of the day that we got that done first and best? What would that be of this list here? Creating the tools, defining the value prop, identifying the employer activities and needs, and also the share models of benefit redesign. One last feedback from you before we open up for discussion, so if you wouldn't mind making your selection, and we'll give you a second to do that. All right, well, we've got some great results back, and no clear winner, but we definitely see a little bit of a hierarchy there. It helps us as we're going forward, and as we have so much to embrace, we want to make sure that we meet priorities of the folks that are going to be supporting us. So thanks for that. Any comments from anyone on why they felt that their priority vote was important? I'd love to hear feedback, whether it was the one at the top on the value proposition or not. Tara, any hands or chat?
I'm not seeing any yet.
We have James Schupert.
Well, only just to say I think the value prop is more strategic. That's really where we have to start with senior management, and the other components are more tactical. So, but you don't get to the tactical unless you've really made the sale on the value proposition.
Were you sitting in on our meeting? You're exactly right. That's what we all agreed, that we've got to make sure that we redefine that and re-clarify that value prop, or anything that we do is not going to have the same kind of impact. And you're absolutely right. And really, thank you for that feedback. It truly, truly helps. So the last part of this, and the next slide, I think, is just an opening up for discussion. We'd love to hear from you on what are we missing, or any objectives or tactics that you think would help us achieve our goals even better or faster, or do you know of any other available policymakers or resources around these particular areas and objectives that you think might help us? We'd really love to hear from you. We've got, it looks like, about 40 some odd folks on the phone today, so I know not everyone is shy.
George Patron, do you want to chime in again?
I would. Yeah, I'd just like to say in regards to the last voting and question, I believe that the polls show that there are more employers on the line today, which is appropriate. And so the proposition that let's look at the value for employers. Again, I am hoping that we all are on the same sheet of music for what being a medical home means. The value of not just optimizing our healthcare delivery in order to make our business office successful and survive in the economic climate we're in, that's important. However, if we all become believers that changing to this type of healthcare delivery gives us employees who are better workers, who are able to have more resilience and so on, that's the key. So that again, I would think in selling it or in making sure we meet our priorities and our goals, it's to, no matter what vocabulary we use, let's promote and walk with our feet, if you will, for as employers and employees and patients, that we want healthcare that is patient-centered, family-focused, that promotes prevention and health as opposed to only meeting the treatment of sickness. No matter what we call it, that's where we need to get to. That will be cost-effective, and of course meet the triple aim all the way around, as well as the military's fourth aim, which is readiness. Readiness of the population to go to work and do what they need to do to keep this country operating.
That was absolutely fabulous. I mean, you've hit it right on point, George, and thank you for that.
Yeah, thanks, George. I appreciate your comments.
Any other comments or questions anyone would like to bring across for our center?
I believe we have a written question. Tara, let's read it.
Sure. So it looks, I'm sorry, I'm going to butcher your name. Teresa Narzikul asked if you could talk about your approach to deployment of PCMH and how payer of employers knows that a PCMH is a PCMH. Is it NCQA recognition?
Marcy, I'll let you take that.
Okay, terrific. Well, it's an excellent question, and it's not one that we've got a lot of clarity around, and frankly, it's one where employers who are interested in participating and partnering with providers who offer a PCMH are frustrated. They're looking to understand what it is we're defining as a PCMH. NCQA happens to be, as most of you are well aware, the largest recognition program. They've got about 5,000 recognized physician practices. And so that tends to be the direction that folks head. But in places like Michigan, for example, a number of different states have chosen to not go the NCQA route and have their own recognition programs through the state, for example. We at the PCPCC are fairly agnostic about who gets to be the decider in terms of, is it NCQA, is it URAC, is it the AAAHC? Those are all terrific organizations who accredit PCMH. They're members of the PCPCC. We're agnostic about who the accreditor is, but we do strongly feel like it's important that there be an outside validator to measure patient-centeredness and the other components of PCMH. We utilize the ARC definition of PCMH, and I think it is something that over time it's a fair request from employers that they understand exactly what it is PCMH is, so that when they partner with a provider, when they prefer a PCMH by either incentivizing through their benefit design, through copays, deductibles, etc. They can explain to their employee just exactly what their employee ought to expect. And Becky, you may have some additional thoughts about this. I mean, this is part of what we see the role of our center as doing, not necessarily being the decider, but in helping move the marketplace to assist employers in what I think is a very fair question.
I think you're right on point there, and it also flows into, I see we have another comment from Teresa Narzikul as far as trying to build out PCP capability around PCMH over time, that there's such a clear need for a consistent approach. And it is difficult, Teresa, to assure that you're going in the right direction. And I think that the focus this center really wants to take is that here is the purchaser of half the healthcare in the country. And so we need to understand from that focal point what value pieces need to be there, and that may help drive more of a consistency in terms of that approach. So we feel like it's on us to come out with a clearer message about what that is, not just for the employers to get engaged, but to be able to create some kind of roadmap or path for those things to become more commonplace. And so hopefully those things will help. And having multiple ways of being recognized as a patient-centered medical home office or provider, I think is actually very good, because it will drive the need and the competition for it, if you will, in that sense, but also it gets to a point of consistency. Okay, any other questions or comments? This has really been wonderful. If you have any more, use the little raise your hand. If not, I am going to turn it back over to Marcy to close things out.
Thanks, Becky. And I want to make sure that I'm giving Tara and Lauren any opportunities here at the end to offer any additional perspectives, any other opportunities for feedback on today's call. Tara, do you have anything else we need to cover?
Nope, I think that's all the questions. Oh wait, I'm sorry, we're just getting one. Hold on. I'm not sure I understand it. Believe that HEOR must be part of the value proposition in order to get everyone engaged. It's still the WIIFM that will drive it forward. I apologize. David, if you can speak, you might be able to explain it better than.
David, I can unmute you if you'd like to speak. If you want to just raise your hand so you know we're about to.
I might just make an ironic comment, because that's how I roll, and that is, you know, so Tara is trying to read his email, and where Tara's getting stuck is on words and acronyms. And if you could just imagine how the average patient and consumer feels trying to live in our world, and many of you today on the phone are in fact employers. It may not be what you do all day long is swim in the alphabet soup of healthcare, healthcare delivery, healthcare reform, insurance. But we've got a long way to go when it comes to explaining what we do and why it's important to consumers. So I just find it a little ironic. Every time I try to explain my job to friends and family and why the PCMH is important, I struggle, because I get stuck on the jargon. So part of what we want to do as a center is also convert the language of healthcare delivery into a language that employers and particularly employees can understand. So that's my ironic statement.
David, you're unmuted now if you'd like to speak. Your point from earlier.
Okay. Sorry for the acronyms. It is alphabet soup, isn't it? We keep creating new ones, it seems.
It's okay. I live in a world of acronyms. I knew what you meant.
Right. I just think that you know, we need more maybe empiric data or whatever in order to kind of drive the discussion and the argument on why it makes sense to move to this model. I think we all agree that it seems like the right thing to do, but I think until we've got some actual, you know, strong data that we can present for employers, for employer groups, for payers, to really show them that is the way forward, and that by, you know, doing more wellness and that type of activity, they're going to have, I mean, it's like George stated, they're going to have a more available workforce, and it's going to save them money, I think, in the long run as well. You know, by doing the right thing up front rather than paying, you know, when things become train wrecks towards the end where they are spending a lot of money. So I just think we need more data in that regard in order to, I think, kind of show that to all constituents.
You're
David,
absolutely.
Go right ahead, Becky.
Well, you're getting right into the key crux of what that value proposition has to have, and it has to have data. It has to have proof that it's as valuable or more valuable than what people are currently experiencing, or else there will be no change. And we have some folks who are absolutely passionate about that are on our center, that have been just constantly beating the drum in terms of needing that data. And I think having more is better. So I don't know, David, if you are with HEOR or not, or if you know someone who might be interested in talking with us, but we certainly would love to bring more folks to the table.
And I would just add to that, David, your point's extremely well made. It is absolutely critical that employers get more data about this model. It's also critically important that policymakers get more data. We've been gathering that data. We put out a report in September. The good news is that the data is finally coming in, but it's a slow process. Obviously, the evolution to a PCMH is a complicated one. It's a journey for those providers. But one of the reasons that we reorganized the PCPCC was to focus on data. And what we were finding is that most folks utilized resources that we developed when it included data, particularly data around outcomes. And so we created a new Center for Outcomes and Evaluation, whose sole function is to scour the environment for data, both from the industry as well as from peer-reviewed reports. And then our job will be to translate that data into meaningful information. Too often, there's data analysis. The data isn't particularly new or appropriate, and yet that's what the media picks up. And so our job is to translate the data into information in a timely fashion. And our Center for Outcomes and Evaluation, which is led by Melinda Abrams from the Commonwealth Fund, as well as Scott Van Valkenburg, who is with Ernst & Young, is I think going to be a terrific asset to our work in that regard. Are there any other comments? Tara, are we at the end of our hour?
We have about 4 minutes left.
Well, I am all about efficiency, and if we have achieved our goals in 56 minutes, I am going to thank you all again for your participation and the terrific conversation that we've had. Becky, your facilitation today was fantastic. Please come back and join us on our phone call in June, the open forum call. Please also, for those of you who are particularly interested and passionate about this topic and want to get involved in our executive committee, we'd love to have more of you at the table helping drive this and drive this center. And so thank you all very, very much, and look forward to your ongoing work and support of the Employer and Purchaser Engagement Center. Thank you very much.
Thank you. Bye-bye.